My name is Maury Blumenfeld. I'm one of the partners in Meditech Advisors. Meditech Advisors is an investment firm that is a partner with a bank called Ziegler in the Ziegler Meditech Equity Partners. Over the past 3 years, we've actually looked at over 270 companies, and we've only selected 7 of those. We've been very, very careful in our selections, and that's one of the reasons that we feel pretty confident about their future. When we're looking at a company to invest in, we look at a number of different things. We look at the technology, whether it's game-changing, is it going to make a big difference?
My name is Maurice Ferre. I'm the CEO of Mako Surgical. Mako is a big game-changing story. It's all about precision surgery and developing orthopedic applications. This technology will really represent a revolution in terms of what's happening in orthopedics. One of our first investors that came in was Ziegler Meditech. That team has a unique vision or ability to really see things and understand how they play out in the medical space. We've been successful in raising over $160 million. In February, we did our initial public offering, our IPO. As you know, 2008 was a very tough market, the public markets. In fact, we were the only medical device company that actually went public. You know, I think the success of Mako is largely attributed to Meditech.
I think the key difference between Meditech and other firms is that we have added value in more than just supplying money to the company.
My name is Peter Pellerito. I'm the CEO with O&I Medical Systems. O&I Medical Systems is a specialty platform unlike any other that has been developed for musculoskeletal applications at the lowest cost at the highest quality. 3 years ago, we were very clear on our strategy to globalize the business, and we needed a partner to come in and help us not just invest in the company, but also to give us a lot of depth into the markets. We had several investors that came to the table, but these guys were very clear on what they could do to help us expand into the marketplaces. The folks in Meditech bring to the table industry people that have actually been on the BD side like Eitan, and Sam has been on the finance side, who've worked inside companies like GE. Then you bring somebody like Maury Blumenfeld to the table, who's been involved with the early development of CAT scanning, MRI, nuclear medicine. So we're very fortunate to have Meditech as our partner in this.
The most important thing is to make sure that the management is appropriate to the tasks that they've undertaken. Aposense, I think, has the ability to be a multi-billion-dollar business.
My name is Yoram Ashri. I'm the CEO of Aposense. Aposense is a company focused in the area of apoptosis. I've known Meditech for several years before. In fact, knowing that they were involved with Aposense was an important decision for me to join Aposense. It gives the company a lot of credibility in my mind. For me as a CEO of a startup company, it's extremely helpful to have access to that kind of expertise. So I often rely on consultations and advice from the team there.
I think we've got a very good portfolio because of the things that we look for. Is there new technology there, and is that new technology something that the market wants?
My name is Martin Roach. I'm an orthopedic surgeon here at Holy Cross Hospital in Fort Lauderdale, Florida. OrthoSensor is a company whose mission statement is to bring the most advanced sensor technology into the field of orthopedics. By working closely with the Meditech Advisor team, I was able to take my concept of bringing advanced sensors to my patients into reality. Eitan Mockover came on as a board member and worked closely with me to define the best financing structure for an early startup company. He then worked with us in defining the round structure and going out and raising the capital. I found that the concepts Meditech Advisor team had actually emboldened my ability to raise capital, which allowed us to close a round of close to $5 million in a Series A.
Even though we're a relatively new fund, we did have one great advantage, and that is we developed a relationship with a large investment house. Highbridge is a part of JP Morgan today.
My name is Ari Storch, principal of Kingsbrook Partners, formerly a portfolio manager for 8 years at Highbridge Capital Management here in New York City. We were very fortunate to work with the Meditech team. They brought us deal flow, which was far beyond anything we saw within the medical tech universe, and we even had an exit in this tenuous environment, which has worked out extremely well in terms of returns to the portfolio. They're actively supportive with their investments, with the companies. They join the boards of these companies as well. Their unyielding due diligence in turning over and understanding companies is unparalleled based on our experience investing in medical technology companies. Their ethics, and when they tell you they're going to do something, how they stand up and follow through. We all have the same values, which at the end of the day is really something that's a common bond that have kept us together, co-investing together for over 7 years.
They really understand the details, they do the homework, and we really come up with results at the end of the day. And it's been like that from day one.
Other investors look up to see what they are doing, look at their moves.
Not only did they bring the financial background, but also the important knowledge of how to set up a company, structure it.
We know that we're going to be working closely with this team, and we're going to rely on them to help us, navigate to what we think is going to be some pretty exciting times in healthcare.
There are 6 billion plus patients out there that will need some medical technology someday in their life, and to think that one day it could be something that we financed, that we helped bring to marketplace, is something when I put my head to my pillow at night, makes me feel really good about what I do on a day-to-day basis.
Well, I remember very vividly the first letter I got after we sent out I think it was about a 4th or 5th CT scanner, and I got a letter from a father who told me, "Your CT scanner saved my son's life."